Reporting live from the Ashley. There's a bug. Did you see it? Oh my God. It had a Gold Gym t-shirt on it. Punched me in the face. I went back. Did you see it? Oh my God. Kamikaze your eyeballs. Is it still on me?
No.
I feel like it's trapped in my hair.
Trapped in your mascara. I don't see it. I think it went down.
Died of glory. The steel, this face of steel and filler, and just died.
Blaze.
Here we go.
Cool. All right.
Wow. It's been a day.
That was a day.
We have talked a lot about insurance, and we've realized a lot of people don't know how insurance works. So that's what we're going to chit chat about today. So, oh, by the way, hi, Ashley.
Teets. I'm Tarra.
Teets and Ash. Yeah. Tarra Teeters, Ashley Pollard. We own a direct primary care clinic in Cantonment, Florida, Greater Pensacola area. So if you're here local or even televisit in Florida, we can see you. So insurance. So
the interesting finding of the day is that the Gen Pop just does not understand how their insurance.
They really don't. So I think to start off with, a lot of people have their employer-based healthcare plans. It comes out of their check before they even see their check. So it's kind of like out of sight, out of mind. They don't really know how much they're spending. They've just made their selections like in November or December, and they know that it's coming out. But then they get used to the amount of their paycheck because it's 40 hours a week. It's a certain pay. You're used to that paycheck. And you never really question, am I really getting adequate, good care? Am I getting the best bang for my buck? Am I getting the biggest benefit out of my money?
Right. So generally speaking, like what is the average, let's say biweekly, because most people are paid biweekly.
Yeah.
Like biweekly, what do you think the average of people take out of their checks for?
I feel like I've always paid a lot. I feel like I've paid
and
like
family.
thousands.
So I guess you have to specify, like we're talking about if you're a single person on a plan by yourself, your employer probably pays most of your most of the costs. But if you add a dependent or a family plan, you start racking up a monthly bill.
And then the different tiers, you always have, so like the bronze tier, the silver tier, and the gold tier,
which is all about deductibles.
Yeah, it's about deductibles. And what they cover a little bit too. So I think on average, what I have been hearing is a lot of people pay anywhere from $400 to $600 a month. It comes out of their check automatically. They really don't see it. They don't think about it.
Biweekly. You think?
So $400 to $600 a month. So like $200 to $300 a paycheck.
Okay. Because I think most people are paid biweekly. So $200, $300
let's figure that
paycheck.
out.
That would be
monthly. That's actually 52 weeks in a year, not 12.
Correct. So I think that for the general population makes more sense when you speak bi-weekly because of how people are paid in general. So if you're paying $200 to $300 every 2 weeks, I mean, you're racking in $600 a month just on insurance.
That's $7,800 a year.
It's $7,800 a year. So that's a big bill that we just write off. Gone.
Plus, you have a $5,000 deductible in a lot of plans, $3,000 to $5,000 deductible. So that's like $12,800 a year to, $10,800 to $12,800 a year in healthcare premiums.
For the just in case.
For the just in case.
Right. Because most people are not utilizing their healthcare. Like how frequently do you go to the doctor? Or how frequently do you go when there's a problem and you go for your yearly, but we have been told like we have got to carry insurance. Our benefits are super important.
So when you're younger, your parents say you got to get a really good job with really amazing benefits. The benefits are, that's where it's at. And we've been told this for forever.
Our entire lives.
You have to have great benefits. That's what you could take lesser pay, but great benefits. But here's the thing, you really don't need this crazy insurance benefit. So another thing, your premiums are going up next year by about 15%. I think this is the first time since 2008 they've increased that much. It's been a little bit every year, but this is a big jump for next year. So if you're paying like $600 a month or $300 every 2 weeks, your premium goes up an additional $45 to $90 a month. Overall, it's going to be like another what? Let's figure that out. Hold please. Hold please. I got to get my calculator. So we'll say 300. Oh wait, 340. Oh my God, today. 345 times 26 weeks is $8,970 from $7,800.
So that's what we're looking for in the future
for next year. Let's just say, yeah,
increase.
you're paying like,
Okay. Well, it's definitely not
plus your
getting cheaper.
$5,000.
Definitely not getting cheaper.
No.
So when we say deductible, we're talking about what insurance is saying. So you're thinking, okay, I pay $300 every 2 weeks, $600 a month for my insurance.
Yeah.
And in your mind, you're thinking, awesome. So I can go to the doctor and I can go to the emergency room. I can go to urgent care. I can go get my labs drawn and it should be covered, right?
No.
Is it?
No.
No. Copays.
No.
There's copays.
And 80/20s.
And 80/20s, right. So the
out-of-network
copays.
people.
So then let's say that you accidentally choose just for labs.
Oh my
if
God,
you
labs are
accidentally
insane.
choose the wrong company that your insurance is not going to pay for, then you get the out-of-network prices. And then you get things like, which it nearly doubles. So you're looking at, $100-ish, $50 to $100 initially just to get the labs drawn. But then the kicker comes later when they bill the insurance and the insurance is like, yeah, no. I pay $3 for this. I pay $3 for this one lab, but we charge $750 for that lab.
Yeah.
So your normal labs that you're thinking, well, I mean, everybody gets this drawn, right? When they're billed through the insurance company, when the insurance company bills or the facility bills the insurance company, get it.
We'll get it.
You are getting an insurance billed rate, which we've talked about.
Yeah.
We've talked about that the insurance rates are higher than what you would pay if you paid cash. So then you get a bill for $597 because insurance paid $3. And you're like, I just had labs
I have insurance.
done. I have insurance. And boom, that's when you get educated really quick on insurances.
Yeah.
Because you start calling people and you're like, what is happening here? I literally just got basic labs done.
And annual labs.
Your annual labs, maybe with one, what you
don't you check a vitamin D.
What you assume was a benign testosterone lab. And then you're like, I mean, how much could it be? How much could it be? And in your mind, you're like, oh, maybe $20, $30. And then they're like, insurance is like $672.
I've had patients with like, they charged me $1,400 for these labs. I'm like, well, if you got them here, it would have cost you $125.
Right. Absolutely. Because
it's crazy how much they mark up labs and x-rays and CTs, all the things. Yeah. So
exactly. But that's when you first get your crash course in how insurance works.
Yeah.
And it's kind of like, it's always like a slap in the face. You're just like, what is
unreal.
that? And then and every single time. So it's happened in our lifetime hundreds of times. Like we, have insurance and then all of a sudden you get this bill and your partner immediately says, we have insurance. But you don't understand because no one's ever really taught you. They just told you had to have it. You had to do it. You had to have this one. You have to, you're paying out the ass in insurances and premiums. And then you don't even know what you're getting covered.
A lot of times you're just not. Yeah, you do it willingly. Here, take my money.
Absolutely.
Here you go. Take it and just, maybe I'm covered, maybe I'm not, but I have the protection, the thought that I am protected in case something, God forbid, happens to me.
That is the craziest thing. I've never really thought about it. Like we just are blindly like, here you go. Yeah, absolutely.
There's $12,800. Take it.
Fingers crossed that
Hug and a prayer chain. You got you covered. People don't understand. I didn't understand the insurance work. I paid it, but then I was always afraid to go to the doctor because I had a copay or I would have, an extra added expense, especially God forbid if they ordered labs. Oh my God. Or an x-ray. You still have a copay.
Well, it's very interesting now that we are verbalizing it that this is like the one place where you go in and you're like, yeah, I'm here for labs, but you literally have no idea like what you're going to be paying in the long run. Or
wait for the bill.
I need an MRI, and they're like, yeah, sure. And then you're like, well, how much do you think this is going to be? No one knows.
I think also too, whenever you get your itemized bill, they send it to you before they have applied the insurance. And you see this bill for like $72 billion. And you're like, oh my God, thank God I have insurance. thank God I have insurance because they're going to cover most of this. And then
Mhm.
they come back and say, well, it was $72 million and you only owe $1 million now. And you're like, I can totally handle that.
Right.
That's so much better. Thank God for insurance.
Until you
Gross.
find out that the self-pay price was $500, not $1 million. You're like, wait a minute, it doesn't make any sense.
It really doesn't make any sense.
And then people talk about, well, I have good insurance. I work for so and so. I have good insurance. So I have good insurance means.
I don't know how it works.
Well, right. One, I
No
don't
one
know how
tells
it
you.
works. But usually when people are like, oh, that you have good insurance, that means that you have less difficulty seeing providers and obtaining tests, basically.
Yeah. You can
Most
get an
people
appointment
accept it.
because they
Mhm.
accept it. You can get an appointment and you can get your labs ordered.
Mm.
That's
You still potentially are going to end
With
up
a
with some
bill.
fallout somewhere.
Absolutely.
But no one's ever been taught this. I don't know why we aren't teaching this in like college. Like
They don't even know how to write a check.
checks are obsolete.
Man, I was a good check floater back in the day. Write it on a Wednesday, wouldn't cash till Friday. I was golden. $20 over at
You
the
remember
Tom
that?
Thumb. God, yes.
You'd be like, listen, don't be cashing this.
Don't be cashing this. Oh, no, you could put it in on Wednesday. You go to Winn-Dixie or Tom Thumb, write a check, $20 over, and you would know my check hits the bank on Friday. That check will clear Friday. It's fine.
Do you remember when people would say, they'd be like, okay, so your bill is $74.20. You're like, $74? They're like, we take check. I'm like,
Oh, okay.
you take a check.
Hold on.
Hold, please. Got you.
Good times.
Not anymore. It's all
We digress.
instantaneous. We're super old.
I remember one really quick backstory, really quick. Nate, Joey's brother, my husband's brother, I took them up to the store and we had to buy beer. I wrote a check for beer, gas, cash over, and it was like the best weekend ever.
I wrote a
check for beer.
gas and beer. That's amazing. That's amazing. That's great.
Great. Yeah. Get a
That's
couple of
good.
cases. Still take a check. It's fine.
Youth. Such a great place to be.
But again, we didn't even know about insurance back then.
No.
We just knew we had to have benefits.
And we were probably paying it, or maybe our parents were paying insurance. I don't know.
You know, when I first started working, I was paying our insurance. It was way cheaper back then too.
Mm-hmm.
Way cheaper. Like you'd pay like $75 a paycheck and have great insurance, literally great insurance. But times have changed. It's become a very huge business model. That's how everything works. And I get it. Everything is a business and everything has to have revenue. And I totally understand that. But we're bankrupting Americans for healthcare. Yeah. We're a threat. It's like a threat. If you don't have this insurance, you're going to die.
Or even when we started with like marketplace for insurance and when I haven't personally been through the marketplace, but I've talked to a lot of people that have, and they're like, you wouldn't believe, like you thinking like, oh, I should be able to afford this, like this is affordable, and then they get on there like, it doesn't even make sense.
So going back to our premiums, like when I was working with you, my premium was $1,400 a month. And then when I quit, they offered us the COBRA insurance. You know, COBRA is you're paying for the entirety of that insurance premium for that policy. Where employer allows you to keep your insurance while you're looking for another job or doing something else, which is nice. And because otherwise, you know, you're going to be without insurance unless you go to marketplace and pay the same damn thing. Yeah, you'll get to pay $2,800 a month because your employer, a lot of times, if it's like a high premium, will pay half of it and then you pay the other half, and that's how you're covered. But it's just gotten outrageous and expensive, and people can't afford it, and people are scared and they want an alternative. So I tell a lot of people, you know, get a catastrophic or high deductible policy. You know, next year we have HSAs that have been approved to pay for DPC membership, direct primary care memberships, which is fabulous. So you can get a high deductible catastrophic policy for things that happen, like heart attack, stroke,
on a random Tuesday.
Cut your head off. You carry that. You carry your HSA card. You pay for things with your HSA card, specifically your DPC membership, and you're pretty much covered. If you have really good foundational health, which is what we like to do here at a direct primary care clinic, we like to make you healthy. We don't want to keep you sick. We don't believe in sick care. We believe in actual health care. So if we fix the foundation and get you on a path to better health, we can keep you healthy, and you don't have to use your catastrophic policy.
Yeah, for the most part.
Pretty simple.
Unless that's final destination.
Yeah, but people are just scared right now because they, you know, like I said, the premiums are going up 15% next year. It's a huge jump.
from our parents.
It's them boomers.
Listen, don't be calling them out on this.
Boomer. It's fine. My parents are boomers. I don't give a shit.
But really, like, that was in their day, that was the thing to do, and it worked. Like,
Yeah.
it wasn't, a third of your income that you were paying for insurances. Like, you paid a third of your income for your house.
Yeah. So like back in the day when I was in nurse practitioner school and we had just had Sophia and Joe was working at the hospital and he was basically working to pay for our insurance.
Mhm.
And I said, this is gross. And then he was paying childcare. Why don't you stay home and do childcare? We'll save that money and insurance. We'll just get a little catastrophic policy or something.
Mhm.
And that's what we did.
Yeah. I mean, it makes perfect sense because everybody carries insurance for the just in case.
Yeah.
Nobody carries insurance because you plan to go to the doctor
Or plan to get something
52
catastrophic.
times a year.
No.
You plan on catastrophic
I
issues.
have a patient today who has been a teacher forever, amazing woman. And she said the only reason why she's still teaching is because of insurance.
Mhm.
She's scared to death to retire. No one should be scared to retire because they don't have insurance.
I know. I hear that a lot too.
It's disgusting.
And I've talked about it all day long today. All conversations have been insurance based today.
Yeah.
Explain.
And they look at you like, oh my God, why didn't anybody say this before? Why didn't anybody tell us?
I know. But
They're keeping you
down.
Yeah.
Like,
They're keeping you in the dark. So yeah, pretty much that's how it is. So you're paying crazy high premiums. You're paying roughly $12,000 a year. Not everybody, but that's including your deductible.
Mhm.
When in actuality, if you got a catastrophic policy, like $300 a month, so it's $150 a paycheck, $300 a month, it's roughly $3,600 a year. You pair that with a direct primary care, depending on age, $780 to $900 a year. You're looking at $4,300 to $4,500 for primary care and catastrophic policy.
Right. I chat GPT some scenarios. Family of 3, 2 adults, 1 child. So option 1, you have your traditional insurance, so your PPOs, your HMOs, running premiums. So this is what ChatGPT's numbers are. Gave me $1,500 a month. So they're looking at $600 to $700 a month, and well, actually more, $800 a month, and putting you at $18,000 a year with a deductible of $3,000 per person, $9,000 for family. So your copays are $20 to $50 per visit. Labs, imaging partially covered. Out of pocket max $9,000 to $12,000 family. So your total annual cost, if you're relatively healthy, should put you at premiums of $18,000, copays, occasional deductible $1,000.
My God, that's like buying a Kia.
$19,000 a year. Then it broke down option 2 of the DPC with a high deductible health plan. So your membership, your DPC membership, $80, and once again, this is ChatGPT's numbers, $80 for adult and $40 for child, putting you at $200 a month, roughly $2,400 a year, with your high deductible healthcare premium at $600 a month, which would be $7,200 a year. Shooting for stars here, like it's
Jesus.
high. So this puts you at your total annual cost of about $10,600 a year.
What was it before?
$19,000.
So twice.
So then DPC with no other insurance coverage is $2,400 a month, and so
that's a lie.
True story.
ChatGPT's lying.
No, these are accurate. Potential
major surgery.
If this was an MI, I bet you could get an ER.
Just rub some dirt on it. It's fine.
Oh my goodness. So that is the concern. So people are always like, well, what if I have to go to the ER? Which we talked about on the last episode, that if you have no insurance, pay prices are options for you.
And they can't turn you away at an ER either. It's an EMTALA violation. So if you're within 200 feet of the door, you have to be seen whether or not you have insurance or not.
And truthfully, even then, I mean, if you fall out in the parking lot, like,
we're going to come get you.
We're going to come get you.
I'm not, she is.
We're going to come get you. We're going to take care of you regardless of your 200 feet or not. We're not going to be like, crawl a little farther.
2 more inches and you're
Keep going. And then we're like, oh, we're in. No, I mean, obviously we're going to go,
Yeah.
but that's the thing. Like, and even in those scenarios, I think about this a lot, truthfully. Like, what happens, you know, you're hit by a drunk driver, just
That's your car insurance.
absolutely just annihilated,
Mm.
right? People think about these things, and that's the other thing, right? That has to do with car insurance.
Mhm.
So people just don't know. They're like, what if I blah blah blah? There's just so many ways around it that we just haven't been taught. And I do believe, like, and I'm not saying that one model fits every
Right.
person. I do believe that every person should be educated
Mhm.
on all the models, though, right? We should be
Absolutely.
given this
This shouldn't be a
information.
secret.
No, and you shouldn't have Teets and Ash over here
We do.
being your educators, but here we are.
Here we are.
I
Do
mean, we
it. It's
should have
fine.
already known some of this, right?
Yeah, it took us years.
So that's just interesting how it fell out like this. Like,
And it was just us listening in the ER to registration,
Right.
telling people, we'll knock off 95% of your bill if you could pay $200 today. Really?
Yeah. And then, but even then, like, I mean, you must have heard something like that a million times, and you're like, wait a minute.
And not
What?
everybody's insurance is created equal. Like you could go to your physician and you walk up to the window and you have a $50 copay. And then here comes
Mhm.
somebody else and they have a $15 copay. I'm like, well, Jesus, what kind of insurance is that? I want a $15 copay.
Right.
Well, it's whoever negotiated your insurance contracts with your employer, that's the person who makes that decision.
Talking about that, let's talk about your employers negotiating with insurances. So you patients come in, we'll just be pretty generic here and talk about certain medications that are super popular right now. Right? People truly believe like we are like holding this information, or like we're charging for, this medication when it's not us. We didn't give you the bill, like your insurance. So your employer opted out
to obesity medication coverage.
So if they opt out of that coverage, regardless if it's obesity medicine, whatever it may be, they have opted out. So that's why your insurance doesn't cover it, because all of the insurance cover, but your employer has to opt in. Also, no one knows this information. They truly believe it like, well,
I've got great insurance.
Sucks. It probably isn't your insurance, truthfully.
And then if you do have employer opted in weight management medication coverage, you still have to ask permission through prior authorization. Mm-hmm. So that's what we do.
Even if it's not the guideline standards, did it today. Not the guideline standards. However, the patient called and said, my insurance wants me to take the medication this way first, which it is not the standard of practice for that condition.
And who at that insurance company said to do it that way?
There was no verbal conversations. This all was through, the pharmacy sent it in and they're like, X-nay. So it's so deep. That's the interesting part about it.
Well, the other part about it is they're following algorithms and protocols and they're clicking boxes, these PAs, and we're literally on a computer clicking boxes to meet their criteria. Prior authorization. It's called a permission slip.
A permission slip, yeah.
So can I have permission to get this medication? Well, I don't know. So you go through and you click your boxes and then you send over the records. Nobody reads that mess. And so they come back, they just know. Because they figure most people are going to say, okay, well, they said no, and that's it, and leave it alone. No, we're going to keep doing it, and we're going to file appeals, and we're going to do all of these things to try to get you what you absolutely deserve, especially if you're paying out the nose for your insurance every single month.
Mm-hmm. Until they just beat you down and they're absolutely refusing. And then you move on and try to
alternatives.
Yep. You have to go with what their plans want you to do when you've just argued till you're blue in the face.
True story.
Yeah. It happens occasionally. They're just not going to give. And so you do the things that they want you to do to get to this place that you need to be. For instance, I personally tore a calf muscle years ago.
Is that your gastrocnemius?
Yes, sure. Mm-hmm. I tore that sucker, and I was pregnant at the time, so I couldn't go. I didn't go. I could have, but I didn't do anything. Later, after delivery, after everything was fine, I tore it again.
Right? What are you doing?
Re-injured it again.
Stumbleina?
Actually, yes.
I knew
fell
it!
up the stairs with flip-flops
Oh,
on. It was flip-flops, and why would I be doing that when I was pregnant?
after.
Feel all
You said
comfortable.
after.
That was
You did it a second time.
the second time. But so I decided, you know what? Maybe I should actually get this thing checked out at this point because I keep injuring my leg. So I go to the doc and I was like, hey, can I get an MRI of my leg? Because
They wanted an x-ray first, didn't
they
they?
wanted an x-ray of my tip fib, my lower leg. And I was like, what are we going to see on that?
An avulsion fracture?
And then, so I had to go get an x-ray that I ended up paying like $400 for.
$75 at the Touchstone.
Was I billed it through my insurance,
Oh.
not knowing I was much younger. This was a million years ago. I billed it through my insurance and they sent me a bill for $400. I'm like, what is happening here? And then I did not end up getting an MRI because I was like, well, Lord.
How much is an MRI going to be?
Right. Because if my plain film was $400, 84 years ago, I mean, definitely. You know what? It's not that bad. I'll just wait till it's just rolling up the back of my leg. And I have, I'm not able to walk any longer, I guess. That's what we'll do.
That's all done.
But that would happen to me, and I was actively working in healthcare at the time. But I did not know. Like, I just did the things I thought I was supposed to do, and then...
Which proves the point. Even working in healthcare, as providers, as nurses, techs, RT, all of us, we don't know how insurance works. Unless you've sat down and become really insurance savvy.
Do you think insurance people know how insurance works?
No. I think they're just...
We need to have insurance people on our show.
We are.
Here we go.
We are.
That is the most interesting. I wish we could do like a column to like some rando insurance and be like, hey, we got some questions. That'd be hilarious.
Oh my God. Well,
I'm sure completely illegal. But
they want all your information and then they're going to blow up your phone every 30 minutes.
Mm-hmm.
Hey, you're looking for insurance on the marketplace. Hey, here's an email. Oh my God, if I get one more phone call. I'm still getting phone calls from 2012. Do you need insurance? No, I don't need insurance. So yeah.
Certainly, that is pretty much like, that is the understanding, the lack of
there's so much more to it. That's just kind of like...
Yeah. So we've talked about how much you're paying, and I don't know. I feel like I want to tell people this information.
I feel like that's what we've talked about.
Or what do I want that person to do with that information? I really just want them to be educated.
I want them to make an educated decision.
I just
based on their finances.
To know what you're paying for.
And again, I told somebody today, I said, you know what? You can drop your insurance. Just see how it is for the next year. You won't have insurance for a year. God forbid something happens. You have a catastrophic policy. You have us here at the DPC. We can pretty much do a whole lot of stuff that a lot of people cannot do. But just try it. They'll always take you back next year. They'll take your money. Don't you worry. They will take your money. They don't care. They don't care.
Not until you ask them for things. Then all of a sudden they care.
Deny.
Not
having it. Appeal.
So that is where we're getting at. You should really do some quick education on your own insurance, or just add it up. That right there will start the fire right there.
Yeah.
If you were to take your pay stubs and add up the amount of money you're paying every year in insurance premiums, and then multiply that by however many years you want to.
Oh my God.
It's a little hurtful. You're like, oh.
Do you know what you could have done with that $12,000 last year? Yeah. Put off all your credit cards, put a down payment on a house. Oh my God, you could have stayed at the Animal Kingdom Lodge in a big, huge suite for 5 days with tickets.
And probably some giraffe feedings and everything.
All the things.
Mickey would have come to your room and hung out.
He'd have made you breakfast.
Maybe. Mickey waffles.
Yeah, so think about that. If you're paying like upwards of $12,000 a year, you're getting $12,000 in healthcare.
Right, that's the question. Are you getting $12,000?
What are you getting for that? Crunch some numbers. Just crunch some numbers.
Do that.
Figure out how much you pay per paycheck. There's 26 pay periods in a year if you get paid bi-weekly, so multiply that times 26. Add in your deductible and see how much you pay out every single year for your health insurance, and see if it's...
See what you think.
Okay.
See what you think. See how you feel after that.
See how you feel. Oh my God.
Teets and Ash signing out.
Teets and Ash out.